super excited to have you on the Bio Breakthroughs podcast by Slice of Healthcare. How are you today?
I'm great, Jared. Thanks for having us. We're excited to talk about on target and our opportunity to serve some patients.
Well, let's kick things off. First, tell the audience a little bit about yourself and how you basically came to be at on Target Laboratories, and then give our audience, for those that haven't heard of the company yet, an overview of the company as well.
Will do, Jared. So I've been fortunate to be in the medical device industry for the last 20 years, primarily about half that time at Stryker, a significant amount of time at Intuitive and Mako Surgical, both robotic entities, and then a stint running the general surgery business for ConMed Corporation, and got introduced to On Target through Scott Hennekins and Gwen Watanabe, who was with HIG, who's one of the backers of the company. Middle of last year, and it was extraordinarily exciting. And Scott's got a tremendous track record in the industry, so drew me in to learn more about it. And the more I learned about it, the more it was an opportunity to really make a difference in how oncology surgery is performed and ensuring that the increased benefits to patients with cancer can be achieved. So really excited to be here. It is.
Well, now, Bill, talk me through what role On Target Laboratories plays in the oncology space specifically.
So, Jared, we enable surgeons in the thoracic space and in ovarian to be able to see cancer at the cellular level intraoperatively. So a lot of times you'll have a PET scan or a CT scan, and those things will do the best they can to give you an idea of what lesions are need to be operated on. What we enable a surgeon to do is when they go into that intraoperative field where it's very different than being in a scan, they can see the actual cancer lit up under a near infrared camera. So essentially, we give a drug that can be dosed up to an hour beforehand or up to a day beforehand. Goes in intravenously. That drug goes into the body. It localizes to cells that overexpress folate, goes into the cell. So endocytosis means goes inside the cell. And then when a near infrared camera goes over top of it, it lights up green, literally illuminates and highlights green. So in that intraoperative field where there's blood and there's tremendous amount of things going on, we give clarity and visibility to the surgeon so that they can actually extract the cancer that in a lot of cases can be missed by CT scans and PET scans, and also enables for precise margins. So the localization and that margin, the negative margin profile, really gives an advantage to the surgeon to be able to serve that patient.
Now, what's been some of the, with what you can share, some of the initial feedback that you've received from these surgeons?
This is one of those things where you're fortunate to be in the situation. And these surgeons have the aha moment of, they go, wow, I wouldn't have seen that. I didn't see that on the scan. I was able to take out cancer in a way I wouldn't have done before under the traditional technologies that I've been able to use. That's why you get in this business. That's why you do the things that we do, and that's really been it's incredibly exciting. At the same time, they're pushing on us to go faster and to get ourselves more indications and work with the FDA, and we're being pulled into clinical studies and different indications and things like that. So that's exciting. When you're being pulled by physicians in to say, hey, we see utilization for this, that's great.
What clinical studies are currently active right now that you can share?
Yeah, so the ones I can share with are we have a number of clinical studies going on, and I'll be a little vague here because we don't really normally publish this information, but multiple modalities within what we do today in thoracic, and then further on in other indications, looking at the way we can help surgeons in other areas that aren't necessarily in thoracic space, making sure that we understand exactly how the molecule works, why it fluoresces in certain areas. And are there ways that we can increase its utilization in deeper tissue and in other anatomy? And really, what that will enable us to do is serve more patients. And in often cases, we're also looking at ways that we can use this to try to avoid surgery, where surgeons can go in and take a look and say, is there cancer that I need to do surgery on after they've done other type of therapies?
What was it about? Let's kind of single out lung and ovarian cancer that make I might butcher this, Cytalux. Did I say it right?
Ah,
Cyta-
Jared, you're right around it. It's Cytalux. You're so
you
close.
told me to.
You're so
um,
close. It's all
we're gonna
right.
spell
That's
it out
good.
though, just so for the Cytalux.
You nailed it.
Right. Perfect. What is it about lung and ovarian cancer surgeries? Like, let's just single those out in particular.
Sure.
That make a lot of sense for this.
Well, so if you think about lung cancer today, it's deadliest cancer that's out that is there. So there's a high need, and there's been a tremendous amount of in the macro environment. Some of the studies that have come out in the last couple of years have really led us to being more minimally invasive driven, and the surgeons have clinical evidence that taking less and less lung is one, it's efficacious, but it's better for pulmonary capabilities of the patient long term. Cytalux helps you do that, and so that's one of the reasons why Cytalux is a great fit in the thoracic space. In the ovarian space, if we think about ovarian and GYN oncology, there's a huge need there, and therefore and a high applicability. So one of the things that leads us to places where Cytalux is very useful is where you have folate A and folate B receptor uptake, and that's what unfortunately, is what feeds the cancer cells. And so where we see that are places where we do clinical studies and we begin to get indications. And those happen to be the first two places that we win, ovarian and thoracic, for lung cancer. Lung cancer, a much bigger market than ovarian on its own, but ovarian is kind of a gateway to other opportunities.
Now, how do you engage with these hospital systems to get them start working with you in the first place?
Jared, it really all starts with describing the ability to help a surgeon with their need, and that surgeon seeing the opportunity to enhance the way that they treat the basket of patients that come to them for these types of procedures. And then from there, we work with the pharmacy and the committees that are necessary to bring the drug in. Fortunately for us, this is a very easy drug to administer, store, and utilize. So there's not a lot of heavy lifting on the facility standpoint. It's not a very difficult drug to work into the workflow for surgery. It doesn't add time. If anything, it helps with time. So there's a lot of pluses that we have on our side there. We do spend a great deal of time with physicians, having them work with other physicians to understand what they're going to see when they go into the first couple of cases. And as they treat patients, we try to be with them for at least their first 15 to 20 patients to help them make sure they get the most of the opportunity as learning curve goes. And candidly, we learn from them. We just launched the drug just over a year ago, and as we work with these incredible surgeons to treat patients, we're learning with them and some of the best techniques, and we try to share that with our other users.
Now, when it comes to these surgeons, how open are they to providing the feedback that you actively look for when engaging with them? Are they fairly open?
Yeah, they are. I think, unfortunately, cancer is so pervasive and cancer is so difficult to treat that everyone's looking for what's the best way. And there's a pursuit to be the best way. And on that journey, we're all on a way of how do we do it better? And I think the approach we take is we think we can help people be better than they are today at seeing cancer. That's what the clinical studies have demonstrated to us. And it's our job to make sure that we demonstrate that for the individual clinician. And we listen to the feedback of how they use the drug to make sure we can share that. And we've been very fortunate. I mean, the surgical oncologists are incredible people to get to work with. And they're just simply trying to do the best they can for patients that are in a very difficult position.
When you kind of look ahead, Bill, obviously things you can share. I'm sure there's a lot you want to share, but I know there's only certain things you can share.
That's right,
Uh,
Jared.
it's just the nature of this business, right?
It is.
But with what you can share, what's really exciting for you in terms of what's next? And I guess are there any pieces of news or trends that you're really heavily or data keeping an eye on, because that'll dictate kind of where you go from here?
Jared, I'd say we are literally the very first to come out with the intraoperative molecular imaging technology. And if you think about where surgery is going over the next 5, 10, 15 years, the ability for surgeons to having such a significant increased visibility of seeing different structures, different things, and that's where we're going, and we know we know we're in the lead there, and we also know that it's incumbent upon us to make sure we continue to invest and drive um, that space. And so we know where we are today is not where we'll be tomorrow. But part of that we're doing now is working with the people that we can work with today and the indications we have to make sure that we learn as much as we can as we expand further. And that's really incredibly exciting to know that we're going to drive the opportunity to treat patients earlier in earlier stage cancer to make sure that we get the most cancer out the earliest possible to give them the best survival opportunity for that patient. Not only the survival, but the quality of life that we all want them to have. That's what's really exciting. And we know that we're starting to see it, where it's proving itself out. We're getting pulled in directions, so we know the need is there. Um, and it's a really exciting space for us to be in.
When we look at, we're already beginning of February recording this, which, well, actually, it'll be almost mid-February. It's crazy. Where is the year already going, right?
Yeah.
uh, when you look ahead, though, for this year, are there any key events coming up like that you would attend that are on your radar? Do you typically like to go to some of these events with the surgeons? Like, what does that look like?
Sure. Anytime we can engage with customers, it's the highlight. That's where we can learn. That's where we can grow. That's where we can introduce the opportunity. We can connect people. So we were just at the at SRS earlier this. I'm sorry, STS, this thoracic surgeon conference in January. We had a chance to connect surgeons who've used Cytalux with those who hadn't yet, and let them tell the story and let them explain to them how it's helped them with their patients. We'll be at a number of different conferences throughout the year. We'll also be at places like LSI. We'll be at the Society for Robotic Surgery, different conferences like that, where we're looking to make sure those that know our story can be updated on it, can understand where we're going, the progress we've made. Just had we have a couple of studies that are about ready to be released as well. We're very excited for those to come out. I won't get quite ahead of the authors on that, but the data that's coming out commercially now that we've been able to be out in the field for a year, and the growth that we're having within our accounts, and that's spreading now. It's exciting, and we're trying to be as thoughtful as we can to grow as responsibly as we can, so we can make sure that those accounts that have the opportunity for Cytalux can treat as many patients as possible.
I love it. What's one last thing you want any surgeons out there listening, in particular, to know that if you had to kind of one last like either call for how they can work with you, what would that be?
Well, our I guess what I would ask surgeons to know is that we're completely open to their feedback, and we're looking to work with them to improve the outcomes for cancer patients. And that's really what we can do. We can serve them in a way that allows them to serve their patients, and we're seeing it, in the 1,000+ patients that we've treated, and on our way to tens of thousands of patients doing that. And we look forward to them being a part of that journey, and a part of that group of surgeons that are connecting around this.
I love it. Bill, before we wrap up here, kind of just like, one or two personal questions, just because
Sure.
I like to add these in here, but would love to hear. You can pick, either name someone who's been a big mentor in throughout your career that you'd like to highlight, a book that you've read that really um, helped shape how you are as a leader or just knowledge in the space, or a course of late that really stood out. That could be even a podcast or something else as well, but you can pick one of those three things, something that had an impact on you.
I would point to David Novak, um, and David Novak is just I think his ability to bring energy and consistency around uh, the way you think and the way you're open to thought and the way you look at other industries to affect how you think about your industry, and then to recognize employees on such a regular basis to build a culture that has momentum around recognition for doing things right. And connecting people. We live in a society that spends too much time divided, not enough time connected, and picking holes of what's wrong as opposed to what's right. And I think David does a great job of highlighting and bringing different people's perspectives to how you can do that.
I love it. Bill, I want to thank you so much for joining us here today on the Bio Breakthroughs podcast. Look forward to continuing the conversation in the future, and hopefully we run into each other at some of these events coming up.
Look forward to it, Jared. Thanks for doing what you do. We appreciate it.